Hello, and welcome to the Art of Being Human. Now, we're dealing with illnesses that affect your personality and affect the way that you work and you think and what you do. And I think one of the saddest things about some of these chronic diseases that we're dealing with is the fact that your muscles get weak or your body doesn't respond normally. Now, we're not going to be doing ALS today, but I am thinking about doing it maybe on the next segment. And what happens with ALS, or motor neuron diseases, and there are several of them, is the fact that the body becomes useless. It doesn't function. And as you get weaker and weaker, the body just doesn't work. I don't know if you've heard of Stephen Hawking. He's a scientist. He is probably the most brilliant scientist of our day. He's the Einstein of our day. And he has a type of motor neuron disease, and he is absolutely helpless. He can't talk. He can't feed himself. He can't take care of himself. He's in a wheelchair. He talks through the use of a computer that talks for him. He can't make sounds. He's absolutely helpless. And if you take a look at his life is chronicled in some kind of a film. I haven't seen the film yet. It's just out. But I'd like to see it because it talks about his illness as it progresses, and he noticed some things, and it got worse and worse and worse and worse to the point where he had no use for his body. His body just couldn't do anything. And he would find that he was just not able to talk or do anything. So now he's in a wheelchair, completely helpless, not able to respond, but his mind is perfectly clear. He can think. He's written books. He's a physicist. He knows everything, a lot of things. He's just a very brilliant scientist, but the only way he can communicate what he knows, what his theories are, what he's thinking, is to have a computer do it for him, because he's just lying helpless in a chair. Well, today we're going to take up myasthenia gravis, and it's a kind of a similar thing because it's a muscle weakening disease. The muscles get weaker and weaker and weaker, and the more you use the muscles, the weaker they become. So I'm going to start off talking about the thymus gland. The thymus gland is located behind the breastbone, like on top of, I don't have a diagram of it, but on top of the heart. So I'm going to talk about the thymus gland. It's a part of the immune system. It's in the upper part of the chest. It's behind the breastbone, but it has two lobes that going around the trachea, so it comes together in the front. So it's in the back of the breastbone. You don't see it if you're looking down at the body, but two lobes of it, two parts of it, swing around and join each other in the front of the trachea. So it's a very, very important gland when a child is young. It's prominent in newborns, and it helps fight infections, and it helps cells to become T cells, and T cells fight infection. That's what their main function is. And it grows larger and larger and larger. And starting from 12 weeks after conception, the baby's not even born yet, until puberty. So it's important in terms of fighting off infection. When it gets to puberty, when the child gets to be the point where they're a teenager, then it starts to shrink. And it shrinks smaller and smaller. And what happens is that as it's shrinking, the normal tissue is actually being replaced by fibrous tissue and fatty tissue. So you have the gland starting 12 weeks after conception, before the infant is born, and it gets larger and larger. It helps fight off infections. It's very important with the immune system. The child gets to be a teenager. It starts to drop back, get smaller, and not do as much. And then as years go by, it's sitting there without a function. It's not doing anything at all. In adulthood, its function is done. It's being changed. It's changing into fatty tissue, into fibrous tissue, but it's not fighting infection anymore. But sometimes what the thymus does is it has a tumor. it builds a tumor on itself. It gets a tumor in some way. And when that happens, that can be one cause of myasthenia gravis. And the myasthenia gravis is sometimes caused by a tumor on the thymus. And what they do is simply take the thymus and remove it. When they remove the thymus, if that's the cause, then the illness goes away and the person is normal again. So they always have to check to see what's happening with the thymus gland if a person develops myasthenia gravis, because it's important in that illness. But that's not the only reason for the illness, and there are some cases where people have myasthenia gravis and there's no tumor on the thymus. There's nothing to be removed. They just have it for other reasons. So let's talk about myasthenia gravis, and I'm going to be using the charts today for that. It's a muscle weakening disease. The muscles become weak and they tire easily. And the muscles usually that are involved are in the face, the eyes, the throat, the limbs. These are the most common muscles that are affected by myasthenia gravis. Droopy eyelids, a blank facial expression, weak, hesitant speech. I know of a pastor, this is kind of as an aside, but I know of a pastor who was giving a sermon, and in the middle of the sermon he stopped, and he says, I have to stop. I am having trouble saying words. I can't seem to get the words out of my mouth. I know what I'm supposed to say, but they just don't want to come. And of course, everybody thought he was having a stroke. So he was taken to the doctor in the hospital, and they did tests, and what he had was myasthenia gravis. He can talk, but he has to limit his speech, because if he doesn't, the speech becomes so faded and so tired, he has to stop talking because the muscles are weak. There is something that happens in the system. It's an autoimmune disorder. And an autoimmune disorder is when the body kind of attacks itself. And all of the nerves that receive stimulus from the brain so they can respond to stimulus are being damaged and destroyed by the autoimmune disorder. So they don't have the ability to respond. I read about a person fairly recently in the local area who was diagnosed as it, and his first symptom was the fact he had weakened speech. He couldn't talk right. And this was this pastor's problem. He didn't know what was wrong. He was diagnosed as myasthenia gravis. It's a very, very, very serious illness. And it's autoimmune. The immune system destroys the nerves in the muscles that are responsible for picking up nerve impulses. You know, your nerves talk to each other. A nerve sends an impulse to another nerve, which sends it to another nerve, which sends it to another nerve, all the way down the line until it gets to where it's supposed to go, and then that the person starts speaking, or you lift your hand, or whatever. In order for me, supposing that I'm putting my hand on the table, and the table is hot, or say it's a stove and it's too warm, what happens? They have the nerve cells fire. Now, this is very, very rapid. It is so rapid, it's within a fraction of a second. And the nerve just go right down to my hand. I lift my hand quickly off the hot stove so I don't get burned. And it's almost like a reflex reaction, but you have to have nerves firing from one nerve to another nerve to another nerve until it gets to where it's going, and then you see, you react the way that you're supposed to react. Well, if you're speaking and you find that the nerve impulses are not getting to the nerves which cause speech because they're being destroyed by the autoimmune disorder, then you're not talking much. And that's what happens with myasthenia gravis. It has a terrible effect on speech. The muscles will respond weakly, or they do not respond at all. Now, it's considered to be a rare disease, only 2 to 5 cases per 1,000 people. That's not very many people, and yet, you know, everybody knows somebody that's got it. I know several people that have it. That's one of the reasons I wanted to do it. No matter how rare some of these diseases are, it seems like everybody knows people that have it. It affects more women than men, and it starts at age 20 to 30 for women, ages 50 to 70 in men. There's a difference in the startup years depending upon whether you are a female or a male. It can develop either gradually or it can develop fast. The muscles may become worse with use and then recover with rest. So a person who's speaking or doing something with their muscles, they have to stop and they have to rest. They can't do very much at a time because the muscles will weaken. And then as they rest, the muscles come back stronger and they can do more. Now, but that's variable depending upon how difficult the person's case may be. They have symptom-free periods and then they have relapses. In other words, sometimes people seem to recover from it for a while and then they get it again. So it abates, it comes back. It abates, it comes back. The eye muscles are commonly affected. You have drooping eyelashes, double vision. There's a weakness in the muscles of the face, throat, and larynx, which includes the voice box and also the neck. It's going to give difficulties in speaking. It's going to give a person a weak voice. They may have a hoarse or nasal voice with slurring of their speech at the end of conversations because the muscles are so tired that they can't keep it up. And it's difficult for chew, and here's the real danger of it. It can affect the muscles of the throat, so it's difficult to chew, difficult to swallow, and it's very easy to choke. This is what people have trouble with choking. You have to be very careful of that with myasthenia gravis. The jaw muscles sometimes actually have to be supported. They have a strap or something to support the jaw muscles in order to prevent the muscles just from drooping. Now, when I've seen myasthenia gravis patients, they sit there and their heads are kind of down a little and they're kind of droopy and they look droopy and their eyes look like they're half closed and their chins are sagging a little bit. That's not because they're bored. It's part of the illness. You know, it's part of the illness. So the jaw muscles can actually hang and they have to be supported. Arm and leg muscles are affected. It's hard to comb your hair. It's hard to climb stairs because the muscles are all affected. They're all weak. It's a muscle weakening disease. The respiratory muscles in the chest weaken, and that causes breathing problems. And this is what frightens me about this disease, is the fact that it can cause problems with breathing. You can have infection or stress or medications, depending upon the medication, can actually make the illness worse. The thymus gland may be abnormal, and in 3/4 of the cases, and 3/4 of the patients, they may have a problem with the thymus gland, which is the reason why I started out with a thymus gland. And if that is the case and they have a tumor, I know somebody with a condition and they operated on the thymus because they thought there might be a tumor there. I don't see that it's made a big change in his condition, but with some people it does. 10 to 15% have a tumor in the thymus, but you see there's a lot of people that don't too. Removal of the tumor restores the person to near normal if they have it. So you just have to think in terms of what I guess this is the last one. Whoop, no, I've got another page here. How do you treat it? It's very discouraging to have that, because when you have that, you can just see yourself getting worse and worse. You can see yourself getting weaker and weaker. But then you relapse, then you get better for a while, and then you have some hope, and then you relapse, and the same thing happens again. And then it can be to the point where you're really helpless, where there's nothing you can do. You have to give up anything that has to do with talking or muscle movements because your body can't take care of it, because all of the receptors that take care of that are being destroyed by the autoimmune disorder. This is a lifelong condition, but sometimes it abates some, and so you have some hope. you do have some times where you have a break from it. The treatment, drug treatment can help the transmission of nerve impulses so the person can do better. And sometimes they can restore a patient to near normal. If you have a case that responds well to medication, you can have a fairly normal life with it. But if the medication stops working, then you're back to square one again. Removal of the thymus, a thymectomy can cure the illness if that's the cause of it to begin with. Corticosteroid drugs sometimes block the illness. In mild cases, the lifestyle of a person is pretty normal, in mild cases. But if you have a severe case of it, or if anyone you know has a severe case of it, you can get paralysis of the throat, you can get paralysis of the respiratory muscles. That can lead to death. So it's a very, very, very serious illness. And whether you survive it or not is partly going to depend upon whether you have a mild case or a serious case. Now, we have times, I'm going to switch to Addison's disease. Addison's disease is related to myasthenia gravis, and there is a thymus connection to it, and that's why I want to talk about it, because one kind of follows the other. So we'll do Addison's disease, and I'll close with this. Addison's disease is rare. It is also an autoimmune disease, and there is a deficiency of two hormones, hydrocortisone and aldosterone, and these are produced by the cortex of the adrenal glands. Now, any disease that destroys the adrenal cortex, which is a part of the adrenal glands, will give Addison's, and the symptoms start out gradually and slowly. The hormones help the body with stress. Those hormones are lost. The loss of sodium and water in urine, muscle weakness, dehydration, low blood pressure, confusion, and coma. Now, usually a person who has myasthenia gravis, there's a relationship between myasthenia gravis and Addison's, which is why I wanted to mention Addison's as a part of this. And if you don't realize that, I'll tell you now that President Kennedy had Addison's. He had a lot of difficulty with it. And times when he was supposedly doing governmental work and going places to take care of governmental work, he was really in bed resting because he was so weak. There you have the muscle weakness, just like you do in myasthenia gravis. There is a connection between the two illnesses, but it caused him a lot of trouble. And it wasn't well advertised. People did not want people to realize that he had Addison's because it's a very serious and rare disease. Other symptoms of Addison's: tiredness, weakness, abdominal pain, weight loss, the darkening of the skin around the palms of the hands and around the mouth, and it's due to excessive production of hormones from the pituitary gland. The treatment is going to be blood pressure. The blood pressure has to be treated because it's usually low. They have to monitor for dehydration. They have to replace the deficient hormones. And I just wanted to mention that President Kennedy did have that disease. Now, I'm going to close it here. I can't get into anything else, but those two diseases are related. So we will continue with other diseases. I'm going into ALS and probably motor neuron diseases next time. And you'll find that there's tons and tons of lots of diseases that are chronic. Even diabetes is chronic. Migraine headaches can be chronic. We're going to hit the major ones. I won't go into all of them, but we're going to hit the major ones because it takes a toll on your personality. It takes a toll on how you react to life. And there's always help available. So I do want for people to know that if you have a chronic illness, you're not alone. There are many others, and there's always help for it. And some of the diseases are terminal, and some of them are not, but they can be monitored. You can feel better. There are ways of treating them. So you need to have encouragement about that. So I will close it now, and we will continue with this next time. Please join me then.